Hello, Peter. So thank you for accepting the invitation to teach a masterclass workshop. It's great. We hoped that you will accept the invitation. Thank you.
Yes, so happy to give it a go.
Yeah. So actually, I was thinking, I was knowing your name since long time because Winfried Häuser, professor at German university, was teaching since long time this Manchester protocol you have developed or your team have developed. So I was knowing your name, but we have not meeting so many times. So my first question is how you learned to use a hypnosis and how was your way to come to hypnotherapy?
Yeah, well, mainly because I'm interested in irritable bowel, and irritable bowel syndrome is a condition where we don't have any good treatments. And interestingly enough, we still don't have any treatments because this was many years ago. And what we were taught in those days was that irritable bowel is a condition where the gut goes into spasm and they're all anxious. They were anxious females whose guts go into spasm. Fortunately, people have realized that that isn't the case, but that's what we were taught as young medical students. And I grew up with that notion of IBS. And then I watched a television program actually on hypnosis. And I noticed that people were relaxing their bodies and they were saying how good it was for stress and anxiety. So I thought, well, that's an irritable bowel. Let's see if we can help them. And so I learned the technique very long time ago now, and practiced on hundreds of people literally hundreds of people around the hospital. So I got quite good at it. And then I decided to try it in IBS, and it seemed to work, but it didn't work terribly well. But what I found was when you focus the hypnosis on the organ, in my case the gut, you seem to get better results. So that's how I developed this sort of gut-directed hypnosis protocol. The other thing in those days, when a sort of card-carrying doctor goes into something like that, people are inclined to think you're crazy. And so what I did, I made a sort of determination that I would publish everything we did so that nobody could argue with. So I designed a proper clinical trial where we submitted patients to either this gut-focused hypnosis or a control group, and found that with this gut-directed hypnotherapy, these patients did very well. And so and the rest is history, really.
Yeah. So it seems you're a kind of person not only looking in the computer, looking for evidence-based treatment, you have been starting to think yourself what could be helpful and developed creatively a new concept, a new idea out of nothing somehow.
And people didn't take it terribly seriously to begin with.
I can imagine. Yeah.
But what was good, because I presented this information to gastroenterology conferences, and I think, but people couldn't argue it because we got that first paper into the Lancet. So it was in a good journal. And so people may have thought Whorwel's gone a bit crazy, but you can't argue with a paper in the Lancet, especially a controlled trial. And so that's the way I've behaved ever since. Everything we do in the department is aimed at getting it published and getting it published in a decent journal. And so even though people were very skeptical to begin with, they couldn't sort of argue with it too much.
Yeah.
I think the other problem was that in those days, that even though it was in the Lancet, we didn't have the internet. And so it was a problem there because these days when you publish something, it's on the internet the next day. So I think that's why it's taken so long to catch on, 35 years. But now, definitely, people are beginning to think, yes, this, and now in guidelines on the treatment of IBS, hypnosis is right up there as one of the first treatments to try.
Okay, and for this workshop, so I assume you will teach the essence, you will give an overview of what is in this protocol, and so people can learn somehow to use it or to start to use it.
Yes, it was quite daunting because I'm quite a brief speaker. Normally, I don't speak for more than a half an hour. And so when I was told this is going to be 3 hours, I thought, what do I do? Do I show them some holiday photographs? So what I've decided to do is break it into 3 sections. So the first section, I thought what I'd do is just talk about the problem of irritable bowel, because I was taught it was a trivial condition in stressed females, which is completely wrong. It's a very common condition, and it affects all people from teenagers upwards, children even. So, and the other trouble is that it is in a small group of patients, a very severe condition. The problem is it's so common in the UK. There are probably 8 or 10 million people, and probably 80%, 90% of them are relatively mild, but a small portion are very severe. But because it's such a big group, these very severe patients exceed the totality of Crohn's disease and colitis. So they're a very challenging group. And they have terrible pain, terrible bowel dysfunction. We've shown that some of them feel suicidal. And so what I thought I'd do is just present the problem of these severe cases of IBS, which are thought to be completely untreatable. Everybody's given up on them. And then show in the next section what we've just been talking about, how I got into hypnosis, and how we've, over the years, carried on producing data to support its use and efficacy, and how we've now even gone into the physiology of the gut and shown that hypnosis can affect or improve the abnormal physiology. And that meeting recently, we show that there's now evidence that the brain function is changed by hypnosis. So I think the more we can bring science to bear on hypnosis, we may never be able to define it. I think people keep on saying what it is, and I don't worry about that too much. But if we can show things that are abnormal in these patients physiologically and show that we can improve that, that's going to be so much more useful in convincing people that this technique works. Because I don't know what it's like in Germany, but certainly in the UK still, there's a lot of skepticism amongst general gastroenterologists and doctors in general. Quite often I'll see a patient who says, I've been trying to see you for years, but my general practitioner says hypnosis is no use. It won't be able to help you. So there's a lot of negativity around hypnosis still in the UK. And I think that will eventually evaporate. But hypnosis has got so much baggage, hasn't it? It's been portrayed in movies as this strange thing where you take over people. Some people, even today, are still quite scared of hypnosis, thinking they're going to be controlled in some way.
Yeah, that's a little bit better here. We did a lot in the media to get a new view of hypnosis, but still, we have similar problems. Will you make something like exercises in your workshop, or will you make a demonstration?
Yes,
if
well,
somebody has a problem?
I very much like doing Q&A, question and answer sessions. So what I thought I'd do, IBS first, break, hypnosis, and then a Q&A, because I think sometimes when you're giving a talk, you're not necessarily giving what people want to know. And so I like doing question and answers. So I'd like to do a Q&A, and then if they want a demonstration, fine, I'm happy to do one.
Yeah. Yeah, usually it's some quite experienced people who are coming often to the master classes, but also with such a topic, some people are especially interested in this topic, maybe new. So
Mm.
it's usually a mixed participant field. Uh,
Yeah.
but yeah, they like to learn something practical, and of course, this Manchester protocols have a lot of great concepts.
Mm. Yeah. I usually, it's always a difficult, when you're giving a lecture or presentation, who do you aim for? And I usually decide, and it may insult some people, I assume a reasonable amount of ignorance, because then at least you're getting to most people. And then if some people are very experienced, they're just going to have to switch off for a while if they think they know it. But even I'm always amazed. I participated in a mini hypnosis sort of thing like yours, but very small one. And even then, I was learning little things that I hadn't thought of before. So, people who think they know it all, I think, are always a little bit wrong. I think you can always learn off other people.
Yeah, yeah. Okay, so is something I should have asked to said what I have forgot to ask? That is a
No,
unique question at the end.
no, I don't think so. As I say, I hope that they'll forgive me for sort of doing IBS, because I think it's so important that people realize just how awful IBS is, and and filling 3 hours when you're used to only filling half an hour. I've got to think of various
Yeah,
things to do. We could have some breaks in the middle, hopefully.
yeah, yeah. Of course, you can make two breaks
Yeah,
and can refocus again. And
yes,
everybody likes to have in such long sessions. Usually, we making two breaks. Yeah.
yes.
But you are the boss of this session. You can decide.
Yes, yes, because my attention span isn't very long, so I assume other people don't have a very good attention span. So I'll do my best.
Yeah, yeah. Somebody have a long time ago have said, I write you a long letter for a brief one. I do not have enough time. So sometimes having 3 hours is maybe easier than telling the essence in 10 minutes. Yeah,
Yeah, I think I've never done it for that long, but I think you're right. You're packing on all this information, so it may be that in a half an hour you give information overload and they remember less. Yeah,
yeah, yeah, yeah.
yeah. Mm.
Okay, so see you next week or in 18th, I think, at what I have even I forgot at the moment because we shifted the day. It
Yes, I think it's the 20th. I hope it
the
isn't.
20th.
I hope
Okay,
it isn't next week because I haven't prepared the slides yet.
okay, okay, okay.
Remember,
Uh,
I felt a mild panic when you said the 18th.
Naja, so usually Enayat is making the interview, but he's staying in Iran, and at the moment he have almost no internet. He cannot even answer emails in the right way. So that is a very interesting situation for him, not being always online. So
Mm,
I'm helping him to make such interviews when he's not able to do it.
mm.
Yeah. So okay, so see you.
See you in 2 weeks or whenever it
Okay,
is.
yeah.
And take care. Bye bye.
Yeah, thanks.